We want mental health to be not a stigma. We want it to be a good thing that you talk about. I am Brad Robinson, Tupelo Fire Department. I'm the fire chief and honored to be in this position. The mental toll and emotional toll that this takes on the guys and the ladies is really tough. You know, we see a lot of bad things, obviously. If you're calling 911, you're having the worst day of your life. We're there in the midst of those things. They're all professional. They all handle the situation. But then when they leave the scene, that's when it kind of starts to hit them then. Being chief, one of the things I've really pushed is I want everybody here to be physically fit firefighters, but I want you to be mentally fit. And it's okay not to be okay. To see somebody struggling as a fire chief is pretty hard. Nobody wants to let anybody see that, hey, we're having trouble with anything. Where we've learned is the guys that they're working with daily are the ones that have to recognize those. And we have several steps. The city has an EAP program. It's totally confidential, free. With it being foremost on our forefront here, we've implemented a chaplain position, a fire department chaplain, something we've never had here. We've actually gone a step further and even started training some of our guys to be part of this critical incident stress team, that they know the signs, and we wanted a peer support. We can recommend that this person go talk to one of those guys on the peer support that's trained in that, so that we can try to stay ahead of this and try to keep these guys in the right mind frame. We're all macho guys and ladies in the police and fire, emergency services. We're all, you know, we're good. So if the public asks us, we're always good. But, you know, just always showing courtesy and respect to the guys and the girls doing these jobs is a huge benefit. Where they're there just to help. Anything to do with kids is always really hard. Anytime that you see the kids and older adults that are having trouble, that anybody that can't take care of themselves, you know, I've told the guys, we need to be a voice for those that can't speak. We want mental health to be not a stigma. We want it to be a good thing that you talk about. You know, in the fire service, this has become more prevalent about suicides. It's more prevalent even here because we lost one of our own to suicide. And it's a hard one because we are tough, we're tight, but that one hurt. That was a tough one. It was really hard to get through, but you know, that's been an instance that we've used that to grow on and use his legacy and memory to continue to drive and be better. I will say the fire department's not just a fire department anymore. Now, these firefighters are not just firefighters. We're an all-hazard department. If it's a rope, a confined space, a hazmat, a water rescue, swift water, flood water, it could be a trench rescue, a building collapse. Those are just some of the few things that we train on a regular basis. There's only one number to call, and that's 911. It's not another number out there that, hey, that's too big for us to handle, call 912. This is it.